Arthritis Month. Did you know? And what you may not know is that the affliction is hitting people at a younger and younger age. More than 50 million Americans suffer from arthritis. And this Saturday, the Walk to Cure Arthritis takes place in New York City. Physical therapist Karena from Active Care Physical Therapy is going to be there walking. But first, she's here to tell us about the walk and why it's so important. But let's tell your story first. This is a cause that's very important to you. You suffer from arthritis.
I do.
What kind of arthritis?
Osteoarthritis.
And where does it affect you?
So when I was 35, I was diagnosed with right hip arthritis, 37 neck arthritis, and then at 39, my kneecap started crunching when I walked upstairs.
What does that mean? Is that bone on bone? Or
so, well, that crunching sound is really like called a crepitus, so
okay.
the joint is getting a little bit more friction and rubbing together.
So you're young, you're fit, you're in your 30s, and you have arthritis. What were the symptoms?
Pain, limited motion, joint cracking, and then dysfunction and pain when you were trying to do exercises.
What was your reaction to that when they say it's arthritis?
When I was 35 and I was laying on the table and my physician friend was doing the x-ray, I was pretty much how I am now, kind of speechless.
Yeah.
Because I was like, I'm 35. How is this possible? Seriously?
Why are so many young people? Is it just that we're diagnosing it better, or is there a reason why more young people are suffering from arthritis?
So osteoarthritis is otherwise known as degenerative joint disease,
okay.
And that's the wear and tear arthritis, and that is the one that people associate with the elderly. More and more younger people are getting it because you have increased activity levels, you have increased intensity of activities, things like CrossFit, urban challenges, mud runners, all of those increases your chances for getting arthritis because of the wear and tear. The more you use your body, right, the more chance for breakdown.
Wait a minute. Now, are you suggesting then that we kind of reevaluate the kind of activities we're doing as younger people?
No, but you need to be conditioned for it.
Oh, okay.
That is important because, you know, I've tried P90X. I haven't done CrossFit yet, but I've had patients who've gotten injured by it because they were doing an exercise that was too great of an intensity and they strained their muscles doing so.
What other tips do you have for people and young people that are suffering from arthritis?
So there's a couple of things. You have to do your strengthening exercises. You have to do your flexibility exercises, utilize self-massage techniques, and use other modalities like kinesiology tape.
Those self-massages, is that where you get on the rollers and you can actually roll things out?
Yes. Foam rollers or handheld rolling devices actually break up all those knots or those fibrous adhesions that can develop when the muscle's really weak and it's kind of straining to do its job. So those are really good with keeping the muscles supple so that they can help support and stabilize the joint.
Boy, I tell you, you get a diagnosis like arthritis. Does that mean a lifelong sentence of pain?
Absolutely not. You might be diagnosed with arthritis, but if you're smart and you keep your body strong and healthy and are proactive about managing any tightness, then you will not live in pain.
What about drugs?
Drugs, you only want to use those as a last resort. They don't, you know, if you're really in a lot of dysfunction and a lot of pain and have a lot of inflammation, sure, you could use them, but that's a personal choice.
And we were talking real quickly, surgery always the last resort.
Surgery is always the last resort. You always have to try conservative measures like physical therapy or just home exercises. Those are wonderful to do. You got to keep the muscles around the joint strong so that they can stabilize and reduce the compressive forces that come through the joint.
Well, one way to do that is walking. Tell us about the walk on Saturday.
So the walk on Saturday, I was honored to be the corporate chair.
Wow.
And it is the Walk to Cure Arthritis. It's the first time ever that it's over and back on the Brooklyn Bridge. So we start in Foley Square Park. My team is Team Active Care Physical Therapy. And we have almost 50 participants on my team. And I'm about $1,000 short of my $10,000 goal. So anyone who is looking to donate to the Arthritis Foundation, specifically under my team name, you know, it's not too late.
Yeah. Well, this is great. And God bless you. I mean, this is great. What a terrific spokesperson. Hey, the Walk to Cure Arthritis takes place Saturday at 10 a.m. Weather should improve by then. Registration opens at 8:30 at Foley Square, as noted. And then, what a beautiful walk for you over the bridge. Karena from Active Care Physical Therapy. Thanks for being here. This was great. Very informative.
Thanks, John.
Appreciate that.